My name is Jacob Witt. I am a radiation oncologist with Cancer Care Specialists of Illinois. I serve patients primarily at the O'Fallon Cancer Center in O'Fallon, Illinois. So I'm from St. Louis, Missouri originally, and went to both undergrad and medical school at Washington University in St. Louis. Before leaving St. Louis, going up to the University of Wisconsin-Madison for my radiation oncology residency, where I was also the chief resident. I've now come back to the St. Louis area where I grew up, and I'm really happy to be back. I chose oncology, like a lot of my colleagues, because I've had personal experiences with cancer, patients in my family. And ever since I was a little kid, I wanted to go into this field, and have been lucky enough to do so. Additionally, as I went through the medical school process, I found that I really liked everything, and I also particularly liked cancer patients. And to go into oncology, and specifically radiation oncology, that afforded me the opportunity to do exactly what I wanted to do. And I love my job, and I'm a lucky guy. Radiation treatment is really a process, and so it starts with the initial consultation where I'll meet you and we'll discuss at length about your diagnosis, about treatment options, and then how radiation fits into the overarching goal, which can be, there's variable goals for variable patients, and obviously it can change from patient to patient, even in the same exact clinical situation. After that, we make sure everybody's questions are all answered. We look at if there are any other staging or other studies that need to be done before we move on to the treatment phase. And then following that, we undergo the actual active treatment phase of treatment, which involves you coming usually daily or even every other day for treatment, where I'll basically be overseeing everything every day, and seeing you as a patient usually once a week or more if need be. And then we basically manage all of the side effects and potential problems during treatment that may come up. And we work kind of in a partnership during that time to make sure that we can get the best possible outcome for you, whether that's relieving pain, curing your cancer, a combination of the two, or other things. That's really the overarching goal, and what I usually tell people to expect. The way that I see myself is really a guide for patients, and so my philosophy for patient care is really to get patients what they want, and to kind of apply my education and my skills to each individual patient that I meet, and that can be highly variable. And so what I do is really, it all starts with communication and talking to the patient and talking to their families, and figuring out for any individual patient what they're looking to get out of treatment. Sometimes that is curing their cancer, sometimes that's taking away pain or taking away other side effects as a result of their cancer. But ultimately, what I'm here to do is act as a guide, with all the experience that I have, to try to get people to feel better and to be able to go back to their normal lives. That's really my goal. Cancer treatment has changed quite dramatically even over the last 5 years, depending upon which disease site you're talking about. If we talk about prostate cancer, there are drugs now on the market that didn't exist 5 years ago, and all 5 of them extend how long people live. With respect to things like melanoma, metastatic melanoma in particular, these patients that used to die very quickly, now we're curing half of them. So there have been enormous changes, enormous advancement made in a lot of different arenas over the past even 5 or 6 years. And it's very exciting, and we're all really happy to see that progress, and it's all really due to clinical research and clinical trials. So cancer research is extremely important because honestly it's the only way that we can improve the outcomes for the patients that we see. We have to test hypotheses in a controlled manner and make sure that the therapies that we give to patients are the right thing for each individual patient. And the only way that we can do that is with prospective clinical trials, testing different approaches for different disease sites. Clinical trials are essentially the way that we figure out if the therapies that we are using are the right ones for each individual person and each individual cancer. What that usually entails is us prospectively testing a certain technology or drug or radiation treatment, for example, and looking and seeing, does this improve how long people live? Does it make people live better? And those are really the things that are important to patients. We can also test other things, like does this help with pain? Does this help people breathe better? Things of that nature. And ultimately, clinical trials are the way that we get the right answer to these questions and then figure out what the best thing is to do for each individual clinical scenario. The way that I've been involved in clinical research has been primarily in partially designing clinical trials and then implementing them, recruiting patients to trials, and also again acting as a guide, helping patients to understand, is this a good option for me? Am I comfortable with this? Do I understand what question this trial is asking? And could this benefit me ultimately by participating? So I don't have an individual proudest moment as a physician, but rather I have lots of little proud moments, and those are usually when patients are cured of their cancer, when they've been relieved of their pain, or when their lives are just improved by the therapies that we give to them. And honestly, that's really just the best part of my job. Every little victory that we have, every little interaction that I have with patients, and so I'm just very proud to do what I do and to be a part of these people's lives.